As we just heard in our previous segment, there's a distinction between social distancing and social isolation, but it's not only our seniors who are impacted. And as this pandemic continues, the mental health toll will grow. I recently spoke via Zoom with Dr. Maggie Mulqueen, a psychologist who joined me from Wellesley, Massachusetts. Dr. Mulqueen, give me some examples of how COVID is affecting the mental health of the people who come to see you.
In a plethora of ways. So I think the most important distinction that we need to make is the difference between social distancing and social isolation. And I don't think that distinction is being made clearly enough to people. We need to respect social distancing and hand washing as our best means right now to save ourselves physically, but we need to really shore people up against social isolation. And one part of that is that social isolation doesn't only mean being alone. There are people who are socially isolated even when they're at home with others, because there may be marital problems, or they, may be feeling a rift within their family or their apartment mates or whomever. So finding ways to help people right now, to reach out, to make interconnectivity a strength, I think is essential to increasing people's resiliency to get through this from a mental health perspective.
Doctor, our health experts have been telling us to look out for the elderly nearby, people who can't get to the store, perhaps who are already immunocompromised. In the mental health landscape, who should we be looking out for?
Wonderful question. I think all of those people and more, no one will be untouched by this. I think just like you think about the layers of who was affected by 9/11, from the people who lost their lives to the first responders, to the family members, to the people who lived in the neighborhoods, to the whole country. And I think similarly in COVID-19, we are going to find people who are going to know this, unfortunately, at the most close and inner trauma to all of us being traumatized by it. So my hope is that if everyone can find a purpose right now, because we know that purpose is what increases our self-esteem, even in good times, if people can find a purpose, one of the best purposes we can find is to find a way to connect, even if it's with just one person. And so I would say, I wouldn't actually say we should identify more this person over that person. It's who do you know in your circle that you can make some form of outreach to.
What are some of the things that concern you that will no longer be, I guess, in the public eye? I mean, if people are stuck at home, they're not going to their jobs, they're not going to schools, what are some of the things that happen inside the home that we won't have insight to?
So first of all, human touch. For those of us who are not living with others, the absence of human touch, we know, is detrimental. I mean, it's why little babies who aren't touched die. So I think anyone who is experiencing an absence of human touch is someone I'm very concerned about. I also think that without the presence of schools under these financially very difficult times, I'm very concerned in an uptick in child abuse and domestic violence. One of the things that mitigates against child abuse is that children are seen at schools. But by not seeing them at school, the belt marks, the black eyes are going to go undetected. The domestic violence is going to go undetected. So I actually am encouraging people, if they are connected to people they're concerned about, that you almost insist to, if you have the capability, of course, to do a visual interaction. We want to, not just do telephone. We want to see, are there dishes piling up in the sink? Are there beds unmade? Has the person not showered in days? Are there bruises that are unexplained? So I actually think for some people, I would push towards saying, I want to see you. I want to see what your home life looks like right now, which is, I have to say, was extraordinary for me this week, because as someone who never wanted to have a practice in my own home because I like the separation between work and home, seeing my patients' homes, I was invited into their homes, which I've never seen before. And conversely, they were invited into my home. So it was a very different way to experience a therapy relationship.
And finally, doctor, this crisis has really exposed many of the shortcomings of the physical healthcare infrastructure. What are the things that you're most concerned about the mental infrastructure, the mental health infrastructure that we have in this country?
So mental health has always been the stepchild of the physical health system. Behavioral health is always short-shrifted. It gets the least reimbursement from insurance. It's hard to access providers. There's much greater stigma. You know, people often talk about if their child had cancer, people would bring meals, but because their child's schizophrenic, people stay away. So there are so many factors already in our system, you know, and then if you happen to have an acting out adolescent boy, the likelihood that you're going to find a provider who can take that risk on to treat that child is much lower. So access to mental health, the reimbursement for mental health, the resources for mental health, community mental health centers, et cetera, have always been short-shrifted. And now the demand is greater than ever before. You know, ironically, I think we are waiting for the P in PTSD. We want this to be post-traumatic stress disorder, but we don't know when that date is going to happen. But when it does, there, you know, we may have flattened the curve on the physical virus, but the implications of this in terms of mental health, I see going on for years to come.
Dr. Maggie MacQueen, thanks so much for joining us.
Thank you.